Good morning. How are you today? Welcome back from the wonderful weekend. All right. There's something I've always wanted to talk to us about, and that is about the use of painkillers. I'm sure you, at some point or the other in your life, used ibuprofen, diclofenac, and every other painkiller you can imagine. Well, do you know that while using these things to cure pain, especially chronic pain like arthritis and all, or menstrual cramps, do you know that while curing this pain, you could be causing another more serious condition for yourself, what we call peptic ulcer? And do you know the symptoms of peptic ulcer? You keep having abdominal pain, abdominal cramps. You keep having an uncomfortable sensation in your abdomen. And in some people who are the elderly patients or those that are a bit older, they could one day begin to present with vomiting of blood, like a lot of blood. And at the point that we are able to intervene, then usually it's too late. So you'll be wondering, what then do we do? We are in pain, why can't we take painkillers? Yes, of course you can take painkillers, but beware of over-the-counter prescriptions. Over-the-counter prescriptions, of course, are just medications that you go to the chemist, you go to the pharmacy, and you just they just prescribe these drugs over the counter, you take it and take it home, and you continue taking these medications. You should be careful of doing that. Your doctor will most likely not prescribe these painkillers, particularly NSAIDs, for more than 5 days or 1 week. If you're going to be taking these drugs for a longer period of time, then you'll most likely be given other medications in addition to these drugs that will reduce the risk of you developing a bleeding peptic ulcer. And so for some people that already have peptic ulcer, it worsens the rate or the state at which they will eventually begin to have bleeding peptic ulcer. So please, when next you have that pain, when next you have the uncomfortable sensation, and you feel, oh, the best thing to do is to use a painkiller, please make sure you contact your healthcare provider, contact your doctor, and make sure that that painkiller you're taking has some form of gastroprotective coating that will reduce the risk or protect you from developing bleeding subsequently. What's even more alarming is that some people prescribe these painkillers for elderly people, and this is actually worrisome because the elderly people are at increased risk of developing bleeding peptic ulcers. You know, they are old, some of them are frail, they don't have enough blood in their system, and imagine them bleeding. Some of them could vomit blood or they could stool blood. So it's something that we all should be very aware about, and we should try our best to curb it to ensure that it does not escalate or deteriorate beyond the way it is. Of course, our elderly people who would be expected to have chronic knee pain, chronic back pain, chronic waist pain, ankle pain, and pains all over the joints of the body. Some of their children just prescribe these painkillers to them, this ibuprofen, diclofenac, and they take it every day, sometimes twice a day, to feel the relief that they want. But this practice is really dangerous because in as much as it is helping to relieve the pain symptoms, it is destroying the gastrointestinal lining, increasing those people to developing ulcers, particularly bleeding peptic ulcers in the elderly. So please be guarded and be on the watch out. Be very careful with the way you take these medications. If at all you're going to take these medications, please consult your doctor. And mind you, arthritis in elderly people is a chronic condition. It's almost lifelong. There is really no medication that will cause an everlasting cure. What we advocate rather is lifestyle modification and other physiotherapy and manipulations that could help reduce the symptoms. But taking painkillers every day, thinking it's going to cure that pain, that is not a good practice. So I hope this meets you well. A word is enough for the wise. Have a lovely day. Bye.